So I've been asked to, give a presentation focused on mentation of the 4 M's. And so the bulk of this work has really been focused on the work we're doing in Alaska. But as Dr. Holloway mentioned, I'm with Memory Keepers Medical Discovery Team, which is housed here in Duluth, one of 4 medical discovery teams at the University of Minnesota. And in this center, I'm focusing my research specifically on dementia caregiving in Indigenous communities. And as was mentioned, also looking at successful aging here in Minnesota, but also in Alaska. But focusing this work, kind of giving more of an insight on how do Alaska Natives and American Indians in the work we've done so far think about cognitive health, mentation, what does it look like? How is it understood? And then comparing that with how our providers who work directly with Indigenous peoples understand that and whether or not there's differences through a community engaged research approach. So to give you just a quick outline, I'll give more formal introduction to who I am, where I'm from, how I got into this work. Real briefly give you current context and risk factors of dementia in our Indigenous communities. And then I'll shift gears and kind of talk about the research we've been doing or I have done and providing more direct quotes from our participants to really illustrate their experiences of living with dementia and caring for someone with dementia. And then I'll give a really quick snapshot of our center here, the work that's going on, the current work that we're developing, some of the resources that have been developed, and then kind of, ending on this idea of sharing about the dementia caregiving work specifically we're doing in terms of intervention development, and then ending up with some time for questions. So the 3 objectives, hopefully at the end of this presentation, everyone will be able to list 3 ways Indigenous peoples understand thinking and mentation, and also 3 ways non-Indigenous providers understand what that is, what dementia is, how it's understood. And then finally, the 3rd one is you'll be able to explain 2 principles of community engaged research or community-based participatory research. So about me, my mom's side of the family are Unungung or Aleut from the native village of Naknek, which is in Bristol Bay, Alaska. It is up near where the Aleutian Islands begin to break off from the state of Alaska to give anyone a visual representation of where we're from. It's about an 1.5-hour flight from Anchorage. Grew up as a commercial fisherman. My family still commercial fish every summer. All my siblings and my family on that side fish. Raised among my elders. My mom was a big advocate of us spending an afternoon with elders every day when we weren't fishing, helping in any way. And I was also blessed with growing up with both sets of my great-grandparents on both sides of my family. My dad's side of the family are from Portland, Oregon. And so I had that side of the family as well, who had lived well into their 90s. So I had really great examples of successful aging. But these are photos here of on the top left are my late grandparents. After living in Naknek their entire lives, they retired to Baja, California, and had a rose garden. And those are my parents there in the middle with their first grandchild in Alaska. And the bottom picture there are my great grandparents who've passed many years ago, who lived independently in the village until their mid-90s, and then my grandfather again. So this is Naknek. It's at the mouth of the Naknek River and flows into Bristol Bay, which is the red salmon capital of the world. So that gives you the left picture there is downtown. That's about all there is. Outside of that is houses, the school, and our clinic. But the right there's an aerial photo of Naknek and the Naknek River. When my parents got married when I was in 3rd grade, I ended up moving. My family and my mom wanted us raised outside of the village school system in Alaska. So we went to Oregon. My parents settled in Cannon Beach. So I went to school there in the winter. And if it looks familiar, this is where Kindergarten Cop in Goonies was filmed. So I was blessed by growing up in 2 different very small rural communities. Really, I think instilled the value I have in community dynamics, community support of our older adults. So a brief context. These statistics are a couple years old, but I think they're kind of maybe staying constant for now, but maybe changing as well. But by 2050, we know that one new case of dementia or Alzheimer's disease-related dementias is developed every 33 seconds in someone, which is approximately 1 million cases per year. And we know that the American Indian Alaska Native population are also living longer, have more people age 65. And with age being the number one factor for having dementia, we have a growing number of people who have the potential of having that. We also have a lot of older adults who are now living with comorbidities such as diabetes, coronary heart disease. There are also risk factors for dementia. And as we think about that, our tribal health systems are beginning to think about how do we work with people with dementia, but I still feel they're really ill prepared for a variety of different reasons. So because of that, as a researcher, we really see this need. There's a need to understand what's happening. And I know I think Dr. Henderson's on here as well, who's one of the leading scholars in this work. And so we think about the risk factors for dementia. These are just some of the more common ones. Limited physical activity or sedentary lifestyle, low socioeconomic status. Also, education would be one of these, hypertension, type 2 diabetes, obesity, smoking, high cholesterol. So as we think about prevention, how do we address some of these when people are younger to hopefully delay the onset of dementia or prevent it? So a few years ago, Alaska has been asking to really start figuring out what is happening. I would say when I started my dissertation work 14 years ago, maybe, dementia wasn't really commonly talked about in our communities, but now we're starting to hear more about it, and for a variety of different reasons, whether it's exposure to social media, the news, healthcare providers, family members, but we still really don't know a lot, even today. There's excellent people and researchers in the field who are doing this type of work. Our center, Deidre Buchwald, Spiro Manson, Dr. Henderson, and others who are looking at understandings of dementia from a variety of different lenses. And how do we take that information and then translate it into interventions, into training and education, not only for our families and our communities, but for healthcare providers? And how do we integrate cultural beliefs into treatment? How can we use this information to improve care processes for families, helping them maybe get a diagnosis earlier so they can have access to benefits? They can get those supports that are so important for them, but also the person living with dementia. We also realize that if we can learn more about this information and find culturally safe ways to provide education and treatment access, that we can hopefully help Indigenous people better comprehend what's happening, and maybe when they get that diagnosis, better understand and adhere to treatment or whatever else is needed to help them maintain a quality of life for as long as possible. And so we did a small pilot study in Alaska. It was the first one in Alaska that's really looked at asking Alaska Native caregivers, and we had people with dementia as part of these interviews if they were available or interested, looking at cultural understandings of dementia. What do they fear? What do they feel are the gaps? And then we asked the exact same questions of our healthcare providers, who included non-Native providers, and ranged from community health aides or behavioral health aides to our neurologists in Alaska. So the way we did this work is, looking at community-based participatory research. One, the study was developed and conducted in response to communities' interest in wanting to know more. So trying to find out, one, how do we conduct the study in a respectful way, but then how do we present this information back? As you think about the principles of CVPR, the community is the focus. They own the data. They're integrated throughout the entire research process. The challenge with this study, of course, it was more of a statewide study. And so we worked with several tribal councils and our Alaska Institutional Review Board to get approvals, but also work and figure out how then do you disseminate this across the state in a way that's accessible, not only in terms of health literacy, but also cultural understandings, and how can it be presented in formats that are accessible to young people, but also to caregivers and older adults. So the first part of this study, we really wanted to learn about, as we were talking to caregivers, Did you notice when memory changes started occurring? Were there certain things you noticed? And in most of the caregivers, as you'll see in some of these quotes, they were noticed changes, but there wasn't a very specific date. They couldn't say, well, it's 3 years ago, or it was October 5th. There wasn't a very specific event that occurred. But over time, they just started noticing, like this caregiver said, probably 5 years ago, 4 or 5 years ago. And another caregiver shared with us, I just started to notice over months' time that things were changed with her. She couldn't remember where she put things, and just her logic and discussions was not right. It was changing. And a lot of these caregivers, that's what they started noticing as the behavioral changes, interactions with people, their engagement in the community and their family. And it really wasn't something that was alarming. They just noticed it. And, whether they were aware of what dementia was or knew to ask their healthcare provider, let them know what was going on. To them, and as as we know in a lot of this work, dementia still is considered a normal part of the aging process for several of our communities. And so it's not something that's alarming to them. It's just something they notice is changing. Another question we were really interested in finding out is, as memory changes are occurring, are they experiencing problems, or are there problems throughout their caregiver journey that they were noticing? The biggest one, the most common problem caregivers experienced and shared with us, was the lack of knowledge of what to expect as the disease progresses. The knowledge also was, what is dementia? Are there certain things that are happening that I need to be aware of, and how do I best care for someone? They were, and of course, as we know, dementia can be very different for every person. But there are some common things we can use or expect and share with caregivers. But this caregiver shared with us, what troubles me most is that I'm trying to make sense of a disease that has no explanation, and it's something you cannot make sense of. To them, that this was occurring to their family member. They kind of had an idea what was going on, but you still really can't make any sense of it because no one can give you a definitive answer on, okay, well, this is going to happen next and next and next, and here's how you address them. Another major problem, maybe not problem, but experienced caregivers shared that was creating some challenges, was personality changes. We heard stories of mom or grandma and the family always being involved in their lives and her lives to support her as much as they're able. And as the personality changes due to dementia, people start staying away, whether it's because they go to a potlatch or they go to her house one day and she's not acting right. And due to their lack of understanding of dementia or what's going on, they begin to just stay away. They quit coming around. They try to figure out what's going on, but from the primary caregiver who may be living with grandma. They may place blame on that person. But this caregiver shared about her experience. They just stay away. And that's the first thing they do when a family gets dementia. The other family, they find out about it and they just stay away. Why stick around when she doesn't remember them? I have to say, though, this isn't the case for every family member, but in these instances, these were the most common challenges that caregivers experienced for the sample we worked with. So I want to make sure that these findings aren't representative of all Alaska Natives or all Indigenous people. So other problems that were challenging for them, was this idea of role shifting. And this has been a really interesting area of our work in terms of, all of us are raised to respect our elders, whatever culture we're from. We listen to them, they're wise, they teach us how to live and be healthy. And if you're a young caregiver, there's eventually that shift in that role where you, as the young caregiver, need to begin telling your older adult, the person with dementia, what to do to remain safe. And for some people, that's really difficult to do because you weren't raised to tell your elders what to do. So this caregiver shared, and it was an odd conversation because I'm used to always being the daughter and taking direction from him. The roles flipped, which is real odd for me, telling him what to do. And then finally, they talked about the lack of accessible education and training resources. And this was across the board. We also hear from our providers that this was another major barrier that the providers noticed in caregivers. but also in their own experiences in referring caregivers to resources, which we'll share later. And so with this lack of education, it's hard to get people to believe you if you don't have something you can show them, because it's your word against the rest of the family. For example, like this caregiver shares, I tried to explain it to my family when he was first diagnosed with dementia. They're really good at denying stuff. It's like, this is not going away. This is not going to get better. This is what we are facing, and I'm going to need your help, but nobody. In several of the families you work with, unfortunately, and in some of these instances, you'd have a family with 8 or 9 siblings, and eventually through whether it's fear, lack of understanding, lack of education, the personality changes, out of those 8 or 9 siblings, there's always that one primary caregiver left who takes on that role. And so it's how do we improve or increase education for other family members? A lot of our caregivers hypothesize that if they had educational materials available in a way that was understandable to them, would that encourage them or help them stay more engaged in the care of their loved one longer, and support that primary caregiver as well, which I think could be another study in the future. So one of the really interesting things, and having gone into this study really expecting to really hear more about the challenges and the unmet needs, the lack of education, the lack of resources, throughout all of that, and every caregiver does talk about, they wouldn't use the word burden, but they do say, it is challenging. It's a lot of work. It's tiring. It's frustrating. But if they were to be in that situation, they would do it all over again. Throughout all of the stories from our caregivers, they all talk about these unexpected blessings. Despite the challenges, there's always a silver lining in every experience they had. So for this caregiver, she shared, I wouldn't have traded it for anything. I was like, I am at peace with what I was able to, the time I spent. My 32-year-old, she was pretty young then. She was in junior high. She said that was probably the best time in her life that she got to spend with her grandma. She said, thank God we had grandma. And a lot of these blessings, which is we have a paper published on this, is looking specifically at, some of the behaviors that are exhibited by people with dementia, such as repetition, may be frustrating for some caregivers. You can't tell them, yeah, we've heard this several times today. As the journey progresses for caregivers, they reflect back on those repeated stories and start asking themselves, were they really repeating themselves, or does grandma or mom or whoever really want me to know that, so when they pass on, I'll never forget it? And so finding those things that when you have a moment, you reflect back and think of, yes, it was challenging, but there's more to it than I think we understand. So we also really interested in figuring out what do caregivers think is causing dementia in Native communities, well, specifically their communities and their families. And it ranged, depending on level of health literacy, educational level, whether or not they've been rural or more urban or go back and forth. But the number one thing they talked about was lifestyle choices as being the primary cause for cognitive changes. This included alcohol use, whether alcohol at all or alcohol misuse, being sedentary, so not being physically active or being on the land, having unresolved trauma in their life they haven't addressed, and of course, poor diet, which we know is also really important. And what they meant by that is we're seeing a lot of Native people, whether they have to relocate or not to an urban setting, not having access to traditional foods or really having to eat more processed foods depending on where they're living. One caregiver shared, maybe drinking, drugs, and alcohol. Elders tell me they drank when they were young, and maybe that had something to do with it, but I don't know. Another caregiver shared, I would think if they weren't physically active, they're just sitting there and not talking or visiting too would affect dementia. And then in relation to that unresolved trauma comment, I think trauma and just constantly being on edge all of the time. And with all of this, they're not, every caregiver we talked to said these are things they think may be causing it. These are not things they know are definitive. Their minds change all the time. And similar to this last caregiver here who said, I don't think there's a clear yes or no answer, but part of old age is that we can see caregivers trying to figure out what behaviors, what things are happening in their older adult or the person with dementia's life that may be causing this. And there's been phenomenal work by Dr. Henderson and other people looking at, there's also spiritual causes. There's a lot of other things that people attribute to what they think is causing these cognitive changes. But as this last person says, there still is a strong belief that it's part of old age. And so it doesn't really bring a lot of alert to some people. But I'd also say, just to add to this, for caregiver causes, I think we also have to be aware of the generational differences as we think about younger people who are caregivers who may have gone to college, who are community health aides, maybe actively engaged in the healthcare system, have very different understandings of what is causing dementia in comparison to people who may be older or the older caregivers who didn't have that exposure to education or interaction more with the healthcare system and what dementia may be. We were also really interested in trying to figure out, dementia is scary for everybody. We all know that's the case. We fear that diagnosis. We fear it's going to happen because we've all heard, it's a terminal illness. This is going to take your life and it's going to change the entire life of that whole family and that community. And so we wanted to be, what do they fear the most? And, I went into this study expecting a lot of different things, right? Like unmet needs, the challenging behaviors. But the caregivers said the loss of elders and their knowledge was their primary fear. We don't document the traditional knowledge, the stories, the history of these families and communities. That's what they're noticing is they're fearing the most as cognitive changes advance. We're not documenting that and it's going to be gone forever. So one caregiver shared, it's a sad thing to see. We always want them to have their wits about them to the very end. That wisdom that they had way back when they were young and what they know. And another caregiver shared, not being able to hear all they know deep within them, the wisdom and knowledge they picked up through the years, the grandmas and grandpas back in the early 1900s, 1800s, and not remembering. And so now we're looking at, are there ways we can document this information, get families to share these stories? As as some of us are aware, there are programs out there, there's tablets you can use now, there's prompts that people can tell their stories. And so how do we look at developing those kind of things that are culturally sensitive? We were also particularly interested if you get a diagnosis or you're aware that something may be happening to the person you're caring for, do you seek out any treatments? And so all the caregivers we talk to have a blended of Western and traditional approaches to treatment, really encouraging whoever they're talking to, the healthcare provider, the person they're caring for, that we need to treat the entire person, not just the symptoms. And remembering that person-centered care was really important. And this caregiver shared their experiences. I'd like to have her provider review the rest of her health other than the Alzheimer's to make sure he's up to date with the meds he's taking and talk about other issues that have been bothering him. So really encouraging, really being an advocate for the person you're caring for, get the doctors to do a more holistic approach. Was mentioned in their first presentation. There's other things that could be leading to cognitive changes, medications, not sleeping well. There's other health conditions that could lead to this. They could be treated and reduce some cognitive changes. They also talked about traditional treatments, whether or not this was at the Traditional Healing Clinic at South Central Foundation in Anchorage, or were things they did in their own home. But one caregiver shared, I had him going to a naturopath for different supplements and things, and different things that help, natural things to help him calm down. And this was the caregiver's way of whether it's tea from the tundra or it's things they've used growing up or things they use throughout their life. And always making sure that when they do that, though, they make sure their primary care provider is aware of that. So it's part of their treatment plan. It's not a surprise. Another caregiver also, outside of traditional medical treatments or traditional healing, they found that music soothed him also. There's this big movement towards traditional foods and music, reminiscence therapy, that caregivers are learning how to use on their own, that we also know are having an impact with populations across the globe. So shifting gears, asking the exact same questions of healthcare providers. As I had mentioned, these are providers of all stages, from behavioral health aides, community health aides, or community health representatives to neurology and MDs. And even similar to what we learned from caregivers, it was really difficult for them to determine the exact date of onset. And this is because most Alaska Natives come in at much later stages of dementia. So this provider shared, some people accept it as a natural part of aging, and they're not too worried about it until the person becomes such a care burden for the spouse, the family, that they bring the person to medical attention, and it's pretty late. And in these situations, it's really hard to provide, they have to really focus on how do we provide resources to help them at the end of life, support the caregiver, support the family. And as you'll learn more about the resources, that can be a challenge as well for some of our communities. They also talked about patients and families not understanding dementia and its associated changes. As we know, a lot of them think it's a natural part of the aging process. So they're, these are just age-related changes. This provider shared, I think a lot of them don't really understand it a lot until pretty much it comes down, they have dementia. So how do we provide that education, that training and awareness, that subtle changes, even if you think it's not something to worry about, to get that, go into your provider, do some of those cognitive assessments and figure out maybe it isn't anything, but maybe it is, and knowing how to best move forward together. When we asked the providers what they saw, and we were asking providers specifically in their interactions with Alaska Natives with dementia, they also brought up the lack of resources across the state was the most discussed problem by every provider. And this provider kind of gives an insight on that. He shared, and sometimes they're very isolated. There was this guy I always felt like there was nothing that I was able to assist with. We tried different things. We couldn't hire respite workers to go in. I was pulling out my hair. It was almost like I dreaded calling him because I couldn't. I didn't feel I could help him with anything. And when you think about these kind of situations where you go to a provider, they can't really refer you to anything because there's nothing available. That then goes, back to the family, back to the community. Why would you seek a diagnosis when there's nothing they can do for you? It is getting better. There are some resources in Alaska now that are being developed, but still it's a huge challenge. The providers also shared how this lack of resources, exacerbated or made worse these family roles and relationships, put a lot of strain on them. And they shared, it's a tough job to care for somebody with dementia. Families cannot do it. You can't be a parent or grandparent and take care of someone with dementia too. So this idea of wearing multiple hats, fulfilling different roles. We know some of our, our families are caring for someone with dementia, maybe raising their own kids, caring for their grandkids. They may be working full time. And so there's really difficult to differentiate that, or having to eventually change your role to be a primary caregiver and reduce your other activities because it's so time consuming. So we asked them about the causes. As you can imagine, being providers, they've been more trained in the Western understanding of dementia. They focused more on dietary changes and being sedentary among this population. But one provider shared, but I think with the changes in the diet and high blood pressure and those kind of things adds to dementia. Another provider shared, and we're talking about the 60-year-olds. They're not as active as the elders used to be. I think that's why we're seeing higher numbers of dementia as well. And then more specifically within the neurologists and the MDs that we interviewed, they spoke specifically about vascular and heart disease, which makes sense. But they shared, it seems like the cardiovascular risk factors are big correlates with dementing processes. So it's unsurprising that many of my patients with either Alzheimer's disease or vascular dementia have comorbidities, high blood pressure, diabetes, and so on. So you can definitely see how they're much more educated in the biological underpinnings of dementia, what's happening in the vascular system and heart disease, and how it differs from the people who are more focused on more traditional understandings, but just equally as important as what we're seeing with our other providers who are more based in the communities. So we're really interested in asking providers also this idea of like, when people come in, what's the course of dementia? Is it some, is it long? Is it short? What is their understanding of what's happening? And we learned from them that despite their scientific training, their medical training, their behavioral health training, their neurology, the providers were much less knowledgeable in discussing and understanding cultural aspects of dementia. This was really surprising for me in a good way. One, that our providers in Alaska acknowledge they don't understand culture and its impact and role in care. and how that should be integrated into their training and how they interact with people who have dementia and just people in general, really. But one provider shared, certainly providers know about it, but it's hard to determine. A lot of things are cultural. If you don't have exposure to those ideas and concepts, you don't know if this is this individual having problems, or this is how, as a whole, people, such as Alaska Natives, think about certain things. And so how do you differentiate that if you don't have a cultural understanding of the background or the understandings of dementia or the spiritual aspects? Is this really just something they're experiencing, or is it tied to the medical understanding, the biological aspects of dementia? And so it's nice to know that our providers now want to work with us to develop cultural trainings on dementia so they can be more effective and responsive to their care. And of course, we were interested in their treatments. What do they recommend when people come in, when they get a diagnosis? You know, they make a referral for resources, but treatments is a big issue. There's a lot of medications that are out there coming out more and more, but they're also not very cost effective or accessible because of high cost. We also heard from the providers, they encourage both Western and traditional treatments. They also try to make them focus on physical activity and dietary changes, again, because that's what they think are the primary causes of dementia in this population. One provider shared, sticking to native foods as opposed to exposing themselves to some of the westernized bad for you foods, berry picking and traditional mushroom picking, and some of the grasses that are known to be good herbal remedies. And surprisingly, even providers who were at the MD neurology stages of their careers and working in that area also really reinforce the importance of traditional healing and realizing that may play an important role in the people they're working with. So one provider shared with us, if people are feeling like they're not thinking right and they're in the earlier stages of having unclear thinking, it can be really helpful for them to use traditional healing techniques, helping them to remember what's important in their life and to help them re-engage in their community, creating more structure, prioritizing, and creating that circle of healing in their own life. So again, recognizing that health needs to have a holistic approach. So as we think about the summary of all of this information, well, this work will hopefully, continue to serve as the foundation of the excellent work that's going on among other centers, getting a better understanding of explanatory models, cultural understandings of dementia. We may think, and we get this question asked a lot, there are a lot of similarities to other racial and ethnic minority groups. There are unique differences in Indigenous populations, but also a lot of similarities. For example, other cultural groups consider it still a part of the natural aging process. They seek support later in the disease process, seeking more resources and supports for family and providers, and this interest and desire to have a blend of more Western and traditional healing methods. We also know that providers have concerns regarding the lack of resources. How do we fix that? That's a bigger, larger challenge, I think, than requires a lot of different entities across the state, across the Indian Health Service, the tribal health system. Also, how do we improve cultural understandings? What does that look like? Is it a flyer? Is it a training? Is it in person that all medical providers in Alaska should go to or in any community? And then how do you increase engagement with Alaska Natives, with other groups earlier in the disease process through, improving access to education, awareness in the communities to encourage people to come in earlier and create that safe space they know they can go in early. And then to remember, despite the challenges, despite, that we know caregiving can be very challenging, dementia is a very challenging disease. Underlying that for a lot of people, there still are blessings that are not commonly found in the literature that we need to remember to ask about and be open to people sharing with us. And to remember that participants are not stating specific answers that may be culturally motivated. And when you're working with this population or other populations, they may not mention the disease by name. This is common in other, such as cancer, suicide. Mentioning it by name is bringing it upon their family. It's going to come to someone that they know if you talk about it. So being okay when doing this type of work that some people may just not be ready to talk about it or want to engage in this type of research at this time. So the implications, what we're doing right now is really trying to figure out how do we develop rural outreach and support groups for caregivers. Alaska has more than half of the federally recognized villages in Indian country. And you can have small villages of 100 people, and you'll have 7 or 8 caregivers who've never known they're all caregiving for someone who has dementia. So how do you create those support groups in those naturally occurring places and create that awareness that other people, and you're not alone, to reduce isolation, increase the disease and the knowledge of the disease process. We also need to work with caregivers. I think, one of my interests is tapping into the knowledge and experiences of our previous caregivers who have been through that journey, who have healed, and now can be a mentor for somebody else. How do we develop training education on, one, Indigenous understandings of dementia, but also what to expect? How do you bring that education and training out to other people, out to other organizations? And then, the center here that we're at Memory Keepers, developing cognitive assessment tools for Indigenous communities that look like them. They use things that are reflective of their own experiences. We also know that we need to develop more culturally responsive support groups, education and awareness. Alaska, for example, we've heard from several caregivers who go to the Alzheimer's Association support group. They may be the only Native person in the room. Their experiences may be too different for them to feel like they connect to other caregivers, and so they quit going. So how do we address those? A lot of this, as we know, takes funding and time and resources, but creating this awareness of these needs from the experiences of those who are going through this journey is important. So to end the research, I just want to acknowledge every caregiver we've worked with, the agencies, the providers, the people who spent time, their stories, the humors and the tears, their recommendations based on their lived experiences were so important for us to learn how to help them and help future generations who will be caregivers. And then we thank all the tribal organizations who are partners in this study and continue to partner with us as we expand this work. Shifting gears, Memory Keepers Medical Discovery Team, just to end, to give you more insight on what we do. Dr. Henderson was the first executive director, did a phenomenal job getting the center off the ground. This is what it looks like on the top floor. Beautiful facility, amazing place to come to work. So now that, Dr. Henderson has luckily been able to retire, and he's enjoying his retirement. We miss him a lot, but our new executive director, Dr. Kristen Jacqueline, was brought in from Canada based on her work with Canadian First Nations people and dementia. And so are in the process, have several R01s from NIH now looking at developing an American Indigenous Cognitive Assessment, AMICA, based on their work where they adapted the Kimberley Indigenous Cognitive Assessment out of Australia for Canada. And so this is their team. So it's still going on. iCare project has been going on for several years. Their work has resulted in a lot of fact sheets. These are all free and downloadable on our website, on the iCare website, on the International Indigenous Dementia Research Network website also, but some phenomenal resources that are really steeped in Indigenous culture and gives more understanding on the process, but also how they understand what dementia is and what that journey looks like. So this is an older slide now. This project is actually finalized now. It's now into another R01 here in America for the American Indigenous Cognitive Assessment. But this project now has resulted in these tools are available online also, in addition to having fact sheets to reach a larger audience for people who may not be able to understand English or read English. It is now available as videos in very different languages, English, Ojibwe, translation, sign language. And so these are all resources that are available to be used. If you have concerns, read about it yourself, read it with your family. Definitely not a diagnostic tool, but definitely can be used to see if there's something you want to bring to your provider to talk about. So as I had mentioned, to end on some of the work we're doing, I know Dr. Henderson has done phenomenal work with the Savvy Caregiver in Indian Country Manual, which is one of the few evidence-based caregiver training programs for Indian Country, and taken this work, working with White Earth Nation, just resubmitted an R01 to look at enhancing the Savvy Caregiver program with a peer mentor model. But as we talked about earlier, the CVPR principles, really making sure community engagement is key throughout the entire process. We've established a cultural advisory board in White Earth Nation. We also have a caregiver advisory board. And so they're going through this process now when we were writing the R01 to look at modifications. How do we adapt or enhance Savvy Caregiver? How do we integrate the role of a peer into enhancing the caregiver training to improve feelings of mastery, but also reduce depression and isolation among current caregivers. So to summarize the key takeaways, the conclusion of all this is that it's wonderful to see that research on this topic is increasing. More people are interested in this work. Communities are open to having researchers come in, kind of share about their experiences. We still know there's significant gaps in our knowledge on how to prevent, treat, and care for dementia across the diverse Indigenous populations. As I mentioned earlier, this data is only representative of the people we interviewed. There may be completely different experiences in another village in Alaska, another Indigenous community. And that cultural understandings of dementia need to be respected and considered in our approaches to care. Not doing so continues a process of colonization. And if you don't know how to ask the questions, practice cultural humility. Cultural safety is this new framework. Well, it's not new, but it's a framework that can be applied to our work across all areas of work, but within dementia care, to look at, what are the power structures, and looking at how do you encourage cultural safety at all levels of an organization, all levels of understanding of what's going on with the disease, to ensure we're providing appropriate and effective care. And then finally, I think it's really important as CBPR, engaging the community, but also partnering with people who have the lived experience, who can provide that insight. As a researcher, we can read the literature, we know what evidence-based practices are, we know what research methods are and how to structure a study that would be funded. But to have someone who has that lived experience, who has been through the journey, can provide insight on what you should be asking, how to ask it appropriately, how to access this population. I think we need to remember it's important to partner with caregivers who have that experience, and build off of that. Some references, I'm happy to share these publications if people are more interested in this work, and want to thank you for your time. I think